My name is Mayur Nagendran. I'm an intensive care doctor, and I'd like to talk to you about the impact of AI dose suggestions on prescriptions by ICU doctors. Standard reinforcement learning agents act directly on their environment. However, clinical reinforcement learning agents are usually part of a decision support tool, and therefore provide the action, the what, as a suggestion to the doctor making the final decision. Explainable RL provides both the what and the why to the doctor, enabling greater context and better integration of the decision support tool suggestions into the overall clinical workflow. We were interested in the extent to which this what and this why could influence prescriptions by ICU doctors. We therefore conducted a between subjects human-AI interaction study with 80 intensive care doctors, each undergoing 16 trials. Within each trial, they were shown data from a real patient with sepsis and asked for a prescription decision for fluid and for vasopressor. They were further shown additional information depending on which arm they were grouped into for that trial. Baseline was our control condition, where they were shown no additional information. Peers, they were shown what other doctors had done for similar patients. AI, they were shown an AI dosing suggestion from our reinforcement learning-based decision support tool. And in explainable AI, they were shown the AI dose suggestion as well as a basic explanation formed from feature importance. The primary measure of interest was dose shift between arms. So if we imagine on the left here, this is the average dose chosen by doctors in the baseline arm. If we, to the AI arm, show doctors this AI suggestion, we might expect that their prescription would be shifted towards that dose suggestion. We might further expect that in the explainable AI arm, their doses are shifted even further towards the AI suggestion, and therefore this marginal shift can be attributed specifically to the explanation. So what do we see? Well, on both of these plots, the baseline is plotted as the green dotted line at 0, and we're looking to see if any of the intervention arm distributions are significantly shifted. We can see that that is not the case for vasopressors on the right. However, for fluid, the intervention arms are significantly shifted towards the left. This effect is more pronounced for the AI arms than for peers, but not more pronounced for explainable AI than AI. We further looked to see if there were other factors affecting the adherence of our subjects to the AI suggestions, and found no impact of clinical experience or enthusiasm for AI on their adherence to the AI suggestions. So in conclusion, ICU clinicians can be influenced by AI suggestions, but a basic explanation does not seem to add above and beyond this effect. We further found there was no correlation between enthusiasm for AI or clinical experience on the adherence of our subjects to AI suggestions. Thank you for listening, and I'd be keen to hear more about your thoughts on this study. Please contact me here.